My name is Emil Chuck. I'm Director of Advising Services for the Head of Professional Student Association, which runs the Student Doctor Network. We love doing these interviews with current professionals, and today I'm here with this great conversation with Dr. Emelia Sam, who is a former clinical associate professor of oral maxillofacial surgery at Howard University and author of the 360 Soul blog, which discuss and which basically focuses on compassion and bringing compassion to your personal and professional life. And she wrote a book back in 2017 called Compassionate Competency, Healing the Heart of Healthcare. And so that's one of the reasons why I wanted to get in contact with her. And I'm hoping that many of you who are joining us for this recorded interview are also interested in these concepts that you're going to be hearing so much about in your education, whether it's med school, dental school, or any other healthcare field, because this is such an important topic. And so, thank you so much, Dr. Sam, for joining us today. All right, so I'm really grateful to talk to Dr. Sam. Let's just take this moment to just start from the very beginning. Tell us more about yourself and your journey.
Yeah, so, well, as far as my dental journey, I think I have not quite the expected sort of beginnings. I wasn't that child who was fascinated with teeth or, a lot of people, of course, they come up in it, it's a family business, that sort of thing, or the people who had braces and formed that relationship with their orthodontist. And I actually didn't have that. I actually was terrified of my dentist. And I don't know why, because I don't remember having a traumatic experience. But, somehow I'm obviously worked that out because I remember, well, both of my parents were teachers and my mom in early childhood, my father in math and science. So I always kind of gravitated towards science. So I knew I wanted to be a doctor of some type, but didn't quite know. So it was really a career day. I think I was in grade 7 where uh, a local dentist had come in and given his presentation. And I just remember at the end of it, I was like, okay, yeah, that's what I'm going to do. So I was 12, but I was a very sort of practical minded child. And, that was the beginning of my, the, I was just very assertive that, yes, this is what I was going to do. So I kind of followed the path. And, at times I would waver as to, well, do I want to become an MD? And the deciding factor in the end was I didn't think I wanted to do a long residency. I kind of like the idea of going to dental school and at the end of it being able to step out into the professional world. Obviously, that didn't quite go that way. I was halfway through dental school and I wasn't quite sure that I wanted to pursue general dentistry, but the one course that really, really just captured my attention from second year forward were all my oral surgery courses. And of course, that requires a 4 to 6 year residency. So here I was about to do a residency, which I was trying to avoid in the first place. But that's okay. That's life. Went with it, and ended up making the most appropriate choice for me.
Well, that sounds great. I mean, I know obviously I clicked to the next question because we anticipate this already. So in any case, so was there, tell us a little bit about those influences, about what really drew you to oral surgery. So you mentioned obviously general dentistry was a little bit different, but oral surgery, there was
Mhm.
definitely some sort of appeal.
Yeah, those first 2 years of dental school are somewhat similar to med school, the courses, and then of course you get to the third year where there's a departure and you're mainly focused, on the clinical sort of aspect of dentistry. I mean, along with the didactics, but there is that focus, so there is that divide, and I kind of missed that. So oral surgery. Um, you presented to me more of what I really, really enjoyed within those first 2 years. So it just made, perfect sense to go that way. And I started to, of course, form relationships with my instructors and professors in the oral surgery department. And, I just knew definitely by third year that this was the way that I was definitely going to go.
Mhm.
So,
So when you were talking with current
Mhm.
residents when you were a dental student anyway, or a very new resident. What were some of the things that they told you about were the challenges of how what did you need to really focus on to complete your residency education? If you can remember some of the things that they told you. So, as you're graduating and trying to think about what oral surgery program you want to go into, or even once you started, things that they kind of mentioned to you, you really need to make sure you focus and pay attention to, with yourself. What were some of the things that you remember them telling you?
Yeah, of course, there was the grades aspect of it. I know things are a little different now, moving to the pass fail sort of format, but of course the grades were, top of mind. And then of course there's the application process that you have to go through, right? So it was the strong recommendation letters. So of course I didn't have any problem getting those, seeing as how I had formed relationships, throughout school. And then of course your personal statement was strong. But the advantage I had was I was a writer. I love writing from when I was a child, and I had that ability to express myself in that manner. So again, I had that advantage. But the personal statement, the interviews, the grades, and then with deciding, now I see students choosing astronomical amount of places they want to go to, which, is I feel for them. I really do, because there's that financial burden, and just the coordination of completing your coursework and having to go on these interviews and that sort of thing to struggle with. But I really streamlined at that time. I I didn't see myself as taking a gamble. Perhaps in looking at my journey, some other people may see it that way, but I limited my choices to 2 schools at that time. I
Okay.
knew without a doubt that I wanted to be at my home school, which was Howard University. I wanted to stay in the Washington, D.C. area. So that made it, very simple for me, as opposed to, I think, a lot of other people when when they're trying to decide where they want to go. Uh, um, oh, okay, sorry, I just lost
No,
you there
that's
for a
okay.
moment. But those were some of the things that, of course, I was encouraged to make sure I took care of, and just getting all my ducks in a row. I think those are the main things that I can remember.
Sure, sure. And
Yeah.
I appreciate you sharing that with us too. Before I sorry if I interrupted. What's I think one of the things that you just mentioned a little bit earlier is that you had the great gift of being able to express yourself. Um, so I'm really interested because you mentioned that the gift of expression was something that you felt was a really strong asset for you. Let's talk a little bit about how you discovered that writing or this type of expression was something that you really wanted to hone further as starting from when you were really young. How did you discover that writing and that type of expression was something that you were really good at?
I think it started with just books. I love to read books. I was reading quite early. So yeah, I was a voracious reader. I think it was probably by 10 or 11 where I started to write. So for me, that started with a journal or a diary, that sort of thing. And then it kind of graduated to poetry. And then of course you had your English classes, and you're learning about essays and structure there and that sort of thing. And it was just something that I looked forward to doing. It never felt like a burden or an assignment only to me. So that's when, I discovered my love throughout those years. But I have to say, um, going into dental school, and I think a lot of us may do these things where we might leave some of our hobbies or our interests behind because we need to focus, or we're told we need to focus on this thing. So just be yes. So it was just that I left some of that behind in dental school. I mean, that would, I don't want to say haunt me, but it would come back and you know um, let me be known that that was a part of me that wasn't being fed. So it was something that I had to get back to down the line, but it was on hold uh, for a few years,
No,
unfortunately.
I appreciate that you address the fact that so many students just feel like you got to hold on to that, or you have to drop it while you're in school. So thanks for bringing that up. You kind of sort of rolled a little bit into my next question that I know I had here was blogging. Blogging, was that something that you discovered while you were in dental school or even in college as an undergrad?
No, actually, I discovered blogging, let's see, in the mid 2000s. So I was a professional at that time. I'd been out of my residency for about 3, 4 years at that time. And the reason I got back into blogging, and this is really important to the story, is that this is the thing about professional school. There is a checklist of goals that you were supposed to attain. And, I figured once I had all of those things checked off, that once I entered professional life, everything would be in order and I would be happy and life would be fine, right? Happily ever after, that sort of thing. And about 2 years or so into my professional life, I just felt this void. There was a void. It took a little time to realize that it was me. That was around the time that the blogosphere was really emerging, was really becoming a thing. So as I was also a personal development junkie. So as I was consuming other people's content on there. I'm going to get back to writing, and this is going to be my regular sort of entry into it. And it was different for me because now my writing would be public. My writing had always been very, very, very private. So that was how I started blogging. But because I still had this idea that I had to compartmentalize my personal from professional, um, I started blogging under my middle name, which is Emelia. Now I go by Amelia all the time, but at that time, everybody knew me as Fran, my first name, Francis, or Dr. Sam. Um, and for several years, nobody knew that Amelia was writing on the internet. So that was another thing that, I had to kind of converge.
So I know I heard a lot of your answer in terms of being able to compartmentalize parts of your life and so forth. So one of the things that I hope that you see the question is how you came up with things to write about, especially early on. As you mentioned, blogging was such a relatively new thing back in the early 2000s. So were you just tapping into some of the emotion of your practice or your professional life to write about it, or just to get, or were you influenced by other people writing on topics and stuff?
Yeah, I was mainly influenced by, I would say, the personal development and spirituality sort of blogs. So when I started blogging, my material was very well, and still, throughout, was very generalized. It wasn't about professional life at all. It was really about just being human, the human experience, the things that we don't necessarily talk about, but are um, so essential to just how we experience everything. Um, Meaning, the big questions, that sort of thing. So my content that I would come up with was generally just through observation. I've always been an observer, even since I was a little child. I'd be very quiet looking at everything else that was going on. So I would write weekly about, it could have been something I experienced, but I wasn't necessarily talking about the details of my experience. I would be talking about the feelings and what does that mean and, how does that play on my spirit and that sort of thing.
Mhm.
Something else that I observed, something that somebody else was going to, or something that I read, all places, but none of it was coming really. I should say none of it was coming from. I didn't write about the profession itself.
Okay, okay. So the title of your blog is 360 Soul. How did that come about? How did you come up with that name? Is that something that you started out with, or that ultimately evolved into that being the title of the blog?
The Initially, it was just e-space online, which was Emilia's space. That's what the blog was. And then I did switch to 360 Soul because again, I was talking about life and questions that really matter to the soul. Who are you? What do you want to be? That sort of thing. And the 360 really came from the idea that perhaps when we get here, I don't want to go too woo, but perhaps when we get here, we know a lot. We know everything we have to know, but as we are socialized, um, we lose some of that, and we begin to question ourselves, and we kind of slip into identities or roles that we might be playing for other people, just society at large. But hopefully, as we have experience, we start to get back to the core of what we really know ourselves to be.
Yeah, no, I was wondering about if you could just expand a little bit more. People think compassion and empathy are just things that you have or you don't have, but you really go into your book and talk about them as competencies. So could you elaborate a little bit more about what your thoughts are about
Yeah, so I again was, at the time I was on faculty, so of course I've seen many students come and go, and I was, just kind of observing how stressed they were, the difficulties that they had that they really didn't necessarily tell people about, that they were struggling with, and I would also listen to patients, whether on there was something that wasn't quite working for them. Um, there was just, there was just this kind of disconnect, because I think in healthcare we have the idea that everybody who goes into it is compassionate, and healthcare spaces are compassionate spaces, and patients don't feel that for the most part. Um, and I was also listening to colleagues and maybe their, uneasiness with just feeling burnt out, and maybe not getting fulfillment from their profession as they thought they would have, as when they went into it. So just looking at this from at all angles, um, I just realized we are so focused on clinical competency, but where is the personal aspect of that in there? Where is not just the empathy or compassion for patients, but also the compassion for ourselves and our colleagues, the whole ecosystem. So that is when, I really began to delve into the idea of a compassion competency, right? And I wanted to make, because when we think of compassion, we think of it as being this mushy, esoteric sort of feeling. And I wanted to bring something practical, something actionable, something that was far more concrete, that we could use in healthcare spaces. So that would be for the benefit of not just the patient, but also for us as teams, and also for us as individuals. Because if we are not, and you see in the last few years, there's been a lot of discussion and focus on well being. And that's for good reason, because if we aren't at our best, we can't give our best. It's a very simple concept. And, the other thing is that healthcare it's personal. When patients come to you, um, that I mean, you have information on them that the general public does not, things that they might not ever share with other people. So there has to be a safe space um, for them to be able to share that with you, and be able to, again, create that bond of trust. And what people don't realize all the time is, not only does that help the patient, but when you're forming those connections, it's also um, it's also helping you. You know, it sounds very. I know a lot of people are like, it sounds very no. It's actually, there is much evidence to show that connection does make a difference on both ends. Yeah.
thank you so much for that answer, and I do appreciate that. This is something that I think many people, especially the last 3 or 4 years too, have realized this is a problem that has really lent a lot of health providers from any different profession just sort of feel much more under pressure. They feel more burned out. And so I'm glad that, again, you were a little bit ahead of the time of the conversation, even though it was sort of there. um,
Right.
so I know from many people who are and you know from students and residents, and I think even with the doctor-patient relationship, whoever, whatever profession the doctor is in, I guess there's always the pressure is to always be quote perfect, or to always, to always deliver good news, or something like that. I just want to get a sense of what, the struggle exists there. To You want to be compassionate and empathetic, but you also feel that this, bulletproof, persona needs to be there too. Talk a little bit about how, and I like the fact in your book you go through a lot of different steps and a little, like 12 different or 10 or 12 different concepts to really help people kind of take a step back. So, talk a little bit more about about some of the things that you've learned, or how you've advised other students or residents about this.
Yeah. Oh, wow. There's a lot in that question.
I'm taking advantage of the server here.
Okay, so where do I start? Where do I start? Well, okay, first of all, you talked about the bulletproof exterior. So, I think that goes back to training a lot and, the idea of the hidden curriculum. Because, a lot of times, it's usually used in the context of medical school, but it's definitely applicable to dental school. Um, and I would think really most of the healthcare, a lot of healthcare training, right? Um, there is this idea that in order to be professional, you must distance yourself and you must steel yourself, especially if you're in a position of having to give that bad news or what have you. Um, it's it's unspoken, a lot of the times, and it's in the little things. It's about whether um, do clinicians recognize people as recognize patients as people or cases, right?
Right.
So from your first time stepping into the clinic, whether your professor is making that distinction or not, you're picking up what it is that they're doing. Um, and a lot of times, I came again oral surgery, Washington D.C., uh, a metro area. We were dealing with a lot of trauma, really, people who had been traumatized because of facial fractures and that sort of thing. And at the time, I couldn't have articulated it, but there was a little bit of a disconnect because a lot of times it was just about getting cases done, right? But all of a sudden, I was seeing patients who uh, were whose cases, not them, but whose cases I might have seen on the news, but now they're a person in front of me, right? So that completely changes your perspective because it's not about fixing a fracture or what have you. It's also about dealing with somebody who suffered trauma, physical trauma, who's been traumatized by the whole experience, and you don't want to further traumatize them within, the care you provide, right? And I use that word care because sometimes it's not care, it's just management or
Mhm.
treatment, but we forget it's supposed to be care. So again, this is how we came to the compassionate competency, and I wanted to break that down. So yeah, I wanted to give people skills and practices and ideals that a compassionate practitioner embodies. So, that's how that came about.
And I definitely appreciate, a lot of the tips and a lot of the insights that you included in the book. So, if anyone is reading, or getting access to this interview, please, take the time to go into the book. It's a really good opportunity to really see some of the practices that really help you express that, your compassion and your empathy a little bit more.
Mm.
One of the things that, as you see in the question, we're doing this a lot in medical and dental education, where we're asking our students to be more comfortable with self-reflection. And a lot of students like to push back. I think, as we mentioned before, it's too squishy of a topic, and so I know you've talked a little bit about it in the book. So, what are some suggestions to help whether they're applicants or students or anybody become more comfortable with the practice of self reflection, especially as outlined in your book?
Yeah, so reflection was something that was completely absent, from my training. It's nice to see that people are actually incorporating it and, with I would say, a movement in mindfulness and things of that nature, that it's become um, more of a consideration, incorporating it into curriculum. But even if you don't have it in a formal class, I mean, there's no reason that you yourself cannot pick up a journal, and even with the pre-health, right? It doesn't have to be just uh, reflections on patience, right? Even before you get to that stage, you can do just reflections on it. It could be anything on your day. Usually, if you've had some, or if you felt that you've suffered some kind of failure, something you would define as failure, or say frustration, just some difficulty, those are great things to reflect on, because it's in that space, and nobody has to read your reflection. It's just about you identifying what happened, what were the feelings behind that, what would you do differently if you had to do it over again, right? Um, And if you're in a group, then you can give each other feedback. But even on your own, reflection is a wonderful tool, because it allows you to develop critical thinking skills. A lot of times when we're in the moment and something is happening, we don't see everything as it is. But sometimes when we take that step back, that's when we actually recall the little details of, oh, maybe I could have, or what if that sort of thing. So just, reflection allows you to take that step back and again develop those critical thinking skills. And that's the kind of thing that's going to help you with your level of emotional intelligence, right? We're talking about you're able to self-manage, keep yourself in check. It also allows you to focus on relationship management, the connections that you have with other people, and getting better at reading other people, understanding what is needed in this situation, but maybe not in that situation. So, just yes, the practice of reflection is invaluable.
Yeah, I thank you so much for sharing all of that. One of the things that obviously, again, we talked a little bit about it before is focusing on the failures, or at least for many students who are like relatively new students. So they'll always make the mistakes, or little small errors, or even big errors. And so, you know, talking, trying to figure out who to talk to and how to frame those little errors, or those little mistakes, um, it's probably very different from like missing the margin of a tooth a little bit in terms of the millimeters and stuff like that. But in terms of really getting, how do you encourage someone to become more comfortable, to become more upfront about talking about those errors or the mistakes, hopefully in a safe environment. But who do you know who you can trust to talk to? What were some of the things that are good signs, I guess, for that?
I'm sorry, some of the things that are good.
Some signs that can help you establish a trusting relationship with someone who you could share some of these concerns that you have, to practice your self care, your empathy.
So, this is where the whole idea, I think, of vulnerability enters in. Um, because we don't want to take that shield down until we're in the safe space. But sometimes you don't know exactly what's a safe space until you take a little bit of the shield down. So it's, and it's also heavily relying on your intuition. Do not abandon that. You will get a sense of who you can speak to, whether that is a colleague or a counselor, or a professor, a friend, like whoever it is, you probably have a sense, right? Never ignore that. But we have to understand that in order to, again, develop that relationship, that it is going to require some vulnerability from our side. So, I'm trying to think specifically in again, the pre-health sort of situation, pre-health student situation. I would think there were I would think there are counselors or guidance counselors, maybe, yes, no, you can probably do
Usually, hopefully.
it. So that's probably a good place to start. But if you really feel that something, there's nobody around you that you can open up to, there are so many anonymous. If you have to go the way of an anonymous hotline, do that. Right? I mean, do that. We have online therapy. There are all sorts of kind of outlets or for people to use.
So I'll change the conversation just a little bit because as it basically happens, there's so many things happening in the medical education world where we're really starting to try to evaluate compassion or evaluate empathy. So, in your mind, is there really an effective way to test for compassion, or even provide some sort of a grade? Because so many students oftentimes are evaluated for that type of bedside manner or chairside manner or something like that. So I wanted to get your thoughts about how can you test for this
Yeah.
competency. You know,
This is where it gets messy. And I think this is where we get uncomfortable with it. So a lot of times we, kind of place that to the side because it's much easier to measure how well somebody did a particular procedure, right? Treatment, that sort of thing. But I mean, there are scales out there, right? We have, what is it, the Jefferson scale of physician empathy and, the version for students and that sort of thing. I think that's broadly used. But, that tends to be one dimensional because it's really only, addressing, say, the physician patient relationship. And empathy goes in all directions, not just in one. So, that has, um, I don't want to say limited use. It's been used so many times in a very useful manner. But, the other thing is it's self reporting. So, I can say that I have all the empathy in the world, but if a patient doesn't feel that, then, again, there's that disconnect, right? Which I kind of feel that the healthcare world has with patients as it is. Um, Empathy is, the idea of a grade, yeah, is out. Absolutely out. I think when we are looking for it, like I know in the what is it, the is it OSCE? The
yeah,
the the OSCE, yes. And I know they grade empathy as far as um has the student, acknowledge the problem, um, listen to the patient, um, rephrased, rephrase the problem, what they think they heard, and then allow the patient to expand, that sort of thing. Those are shows of empathy, right? So when you're grading that, we're actually grading the performance. I can't actually know what it is that you feel on the inside. I know you're going through the motions, and I think those things are actually helpful, for people who may not do those things naturally. I think those things are helpful, but they're a start. I don't know that you can again gauge the you can't gauge the intangible, right? There are
right,
cues. Looks good, it's great. Like I said, it's a start. But again, this is where we get a little uncomfortable because we like black and white. We like definitive margins and yes, this is good. No, this is insufficient, that sort of thing. And empathy is not quite, you can't do that with it. We can head in the right direction, but I don't think we're ever going to pinpoint, right, an exact measure. I don't think we can do that with aspects of humanity.
right. I appreciate that. You may have probably heard because you pointed out a little bit earlier. One of the current trends in technology. You may have read the article that talks about generative AI, these chatbots that, you know, somehow or another you help physicians sound more empathetic. So I think you did a little bit along those lines. You know, tell me a little bit, or you tell me your thoughts about, you know, should these, you know, these programs or the large language learning models, you know, really help us figure out how to communicate better in a more empathetic way.
Yeah, I mean, I don't, a lot of people love AI, hate AI, that sort of thing. I'm like, no, 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 no. I think there's an absolute use for it, and it's not like we can, discard it now. It's here. The idea is technology is never an issue. It's what we do as individuals with the technology, right? So I see AI as being helpful in that way, and I think I did read that article, specific article you're referring to, and doctors coming up with scripts, right? That they could, Chat GPT gives you a script, and you can use that with the patient. I actually don't have a problem with that. Again, if somebody is aware enough to know they lack empathy and are seeking a way that they can at least show, what will be interpreted as empathy, I'll take it, right? It's better than nothing, and it brings to mind a study that was done. I was listening to Stephen Treziak, Dr. Stephen Treziak. I don't know if you're familiar with him, author of Compassionomics,
Okay.
and he was talking about a study that was done with oncology patients, and they were testing for the patient's anxiety um, after having their first consultation, right? So these are cancer patients. They're obviously going to be anxious and that sort of thing. And they found that when they did a compassion intervention, it greatly diminished the sense of anxiety that these patients had. And the compassion intervention was just a 40-second script. It was 20 seconds at the beginning of the consultation, saying, I know this is a difficult time. I'm going to be here with you through this, and, that sort of thing. Just 20 seconds. And at the end, they reiterated. And the patients who received that intervention greatly had their anxiety diminished. So I do see the use in a script, right? The work that I'm doing is, yes, we can use the scripts, but I also want to shift something internally, right? It brings to mind another book that really influenced a lot of my work, Daniel Pink's A Whole New Mind. And in it, he talks about a lot of things, but he talks about the fact that, we have everything in abundance and it's at our fingertips, and technology is just, racing at this alarming pace, right? But because of that, people are actually craving, whether they can articulate it or not, they're craving that human sort of touch and connection. So his idea was that even though we are in this, we've been through this, or we're in this age where technology is excelling everything. He calls this the conceptual age, where people, again, are reaching for that connection. So the people who have high emotional intelligence and can kind of deliver that will probably excel. And we actually kind of see that if you look at, storytellers are everywhere. The people who are doing really well on, say, Instagram, they're telling stories behind the scenes. It's about human connection. So, coming back to AI, it's useful, but we still have to work on, the aspects of our humanity that AI can't quite yet replicate. Even if, hey, there are going to be some people who are going to be just fine with, AI telling them or diagnosing them or whatever, but you're still going to have to come um, to a human, a professional, for that um, diagnostic referral. They're still going to need things from us, and when we get them in front of us, we have to make sure that we actually provide that connection that they're probably craving, whether they know it or not. So, I think that there will always be a place for us, and if there isn't, then I think that's far, far off in the future.
Fair enough.
We need to work on ourselves internally, um, before we try to get the robots to demonstrate that. Like we haven't even mastered it and we're trying to get AI to perfect it. So
Exactly. I appreciate it. I do want to make sure I get a chance to hear from you. You've mentioned a couple of your favorite books, and if
mhm.
there are other blogs or influencers, podcasts, whatever other things that also have influenced you recently, and especially as you're in your current work.
There is, a fantastic podcast. I just discovered in the past couple months, but it's been around for a while. And it's called The Nocturnists. I don't know if you're familiar with it. It was started by Dr. Emily, I believe, Emily Silverman.
Okay.
But Nocturnus is it's described as a medical storytelling platform. So it's really all walks of life within healthcare, and they're telling their personal experiences. How maybe healthcare may have changed them, or for the better, or for the worse. What did they do to resolve that? But sometimes it's interviews. It's just a variety of experiences. So Nocturnus is definitely one. And then a couple influencers. I would say I really like Dr. Danielle Offrey. Don't know if you're familiar with her, but she is a physician. She's in New York. I think she's at Bellevue, but she's an essayist. So she's had many, many articles, New York Times. She has several books. One book I really liked was What Doctors Say, What Patients Hear.
Okay. Yeah.
She also, has a couple TED Talks and talks about medical errors, and what does that mean, and how do we allow for that in a healthcare setting? Because really, you're supposed to be perfect all the time, and we're human too. So, how do we reconcile that? And another new influencer, um, who you may know because he's on LinkedIn. That's where he's kind of building his team. Dr. Jonathan Fisher,
Mhm.
love him,
Yeah.
cardiologist or the mindful cardiologist. So he's becoming a very strong voice in um, how to look at things from a mindful perspective, and just a wonderful human being. And he'll have a book I think is coming out next year, Just One Heart. So
Hmm.
out for that.
Cool. Cool. On this, I know on the academic side of things, this is all burgeoning as, I guess, under an umbrella that they call narrative medicine. I'm not sure if dentistry will have its own version of it, but
Mhm.
I do appreciate that a lot of effort has been going in with humanism and really trying to have individuals who are interested in narrative medicine, sort of take the steps to do storytelling. So
Yeah.
hoping in the near future, maybe I don't know if you've been connected with or would if we knew if there's anybody who would like to connect with Dr. Sam on it's a lot of the narrative storytelling, especially for dentistry. I'm not sure if any of that might be something you might be following, but it sounds like many of those
Mhm.
influencers are in that area in that field. So I do appreciate it.
I yeah.
So one other question I know, because it's been a few years now, we've gone through the COVID years now. If you were to write an update, are there things that you would change or include or add to the book in retrospect?
I tried to write the book kind of like as a skeleton so that whatever somebody's experiencing, they can superimpose on that framework. Um, so there's not much I would change as far as the concepts that I outlined in there. But I think one thing I would definitely um, address and elaborate on just a little more, because I didn't want to make a textbook. I wanted something that was easy reading, right? But students have enough to read. I didn't want to put that on their list, but I wanted something that would be easy to digest. However, I think the one thing I would elaborate on would be the communication portion of my book. And I think that's been influenced by not just in the COVID era, even prior to that, but just this whole idea of misinformation and how we communicate with patients, to still get them to trust us, um, and how not to battle or feed into that because there used to be a time where communication was one way and generally the professional had all the information, patients had nothing, so you gave them information and that was the end of the discussion, right? And that's not what it is anymore. By the time a patient comes to you, a lot of times they've already gone to Dr. Google and now Dr. TikTok, right? Like, and don't get me wrong, there are some wonderful people on TikTok, but there are also some, sadly misinformed people as well with huge platforms. So by the time they come to you, they may have already seen this other information. And what is it, or how is it that, how are you going to acknowledge what they have um, mistakenly took for good info, but not belittle or disregard them in any way, but sort of welcome them into learning what true medicine is. So yeah, I would definitely again elaborate on the communication portion of the book because I think that is something that has greatly shifted in the patient clinician dynamic.
Yeah, I definitely can concur on that. And so, yes, thank you. And maybe a next version or next edition, we'll see. Or it'll be another blog entry. I'm hoping one way or another about that. So,
Exactly.
I do want, so again, thank you. And I appreciate, the patience through whatever weird server issues we had earlier. I did want to get some, is there any other things that I need to cover that you want to make sure that we can cover? Words of support for individuals or whatever else like that. What did I miss, or at least what wasn't clear? What we thought didn't come through the server?
I don't think you missed anything, but as far as words of support, if anybody can learn anything from my story, it's that whatever path you are on, um, we tend to be so externally focused. We get focused on the checklists. What must I do? What is required of me? And that sort of thing. But it's so important to um, turn that inwards. Sometimes you have to check back internally because sometimes you just go so far down that list and you are so, far removed from who you want to be or who you once were. So it's just so important to feed that part of yourself. Understandably, these are tough programs. They require a lot of you. Um, but it should never be to the point where you completely sacrifice, the core of who you are. So there needs to be those consistent check-ins because your well-being really is the foundation of everything else that you're going to be able to provide. And if you have a faulty foundation, it doesn't matter what you build on top of it, it will come crashing down at some point. So use the resources, do what you must, but like I said, keep checking back internally and find a way to feed yourself the things that you really, really need throughout your journey. And you're just going to be so much better for it and that much stronger of a professional as well. So,
So before we leave, I just want to also make sure: are you still currently in practice, or what are you doing nowadays? What's your current what's pushing you forward in life, and what's making you happy now?
yeah. So now all my work right now is virtual. I have actually fallen into the role of caregiver to my, elderly. Not did I say unfortunate? Not no. I have fallen into the role of caregiver. Um, and this is where I want to be. I lived in Washington D.C. for many, many years, and now I've moved back home, and this is where I want and need to be. So the work that I do is virtual, generally speaking, either to educators or student populations about compassion, and again giving them those practical tips that they can carry with them through their professional and personal life. So a lot of it is virtual lecturing at this point.
Okay,
Yeah.
and hopefully, I mean, have you had chances to talk to current dental students, medical students, or any or all assorted professions?
Yeah, actually, I know there are some populations that are using my book for their programs. Some pathway programs right now, and
Okay.
occasionally I have some opportunities to talk to them, and I should be talking to actually possibly a residency program next month or the month after as well. So it's kind of all levels, and the thing is, sometimes I have these bulk purchases of books, but I don't actually know where they go. So, the populations I talk to, are varied, but yeah.
Sure. So if you're talking to pipeline programs, are we talking high school kids as well as college undergrads, or
I
just
did
wondering?
have one instance where I think I had a few high school kids, but generally they're students who are in undergrad, and sometimes in professional school, so maybe already in dental school, but the majority are pre-health students, undergrad.
Well, I definitely thank you for sharing your time with us, and anybody else who winds up joining us for this interview or any of our short videos that are going to come from this interview. So thank you so much for spending your time with me, and anybody else who's interested in becoming, yeah, at least understanding their compassionate competency as something that they can improve upon for the rest of their lives. So thank you so much. I appreciate your time.
Thank you, Emil. Anytime I can have these types of conversations, I am there for it. So thank you for the invitation.
Great, thanks.